And how do you see it going? Like, do you have kind of a goal for where you want to take the business?
Our goal is to be a household name for nurse practitioners and PAs, more so if they ever have had that dream to start a practice. This this little piece of the puzzle is not what will hold them back. I can't do your marketing for you and
Right. Yeah.
set up your website, but if
Yeah.
finding the doc is the thing that's the holdup, let we want people to know that should not be an obstacle.
Hello, everyone, and welcome to our favorite part of the week. It's time to listen to Sounds of Health, where we share the stories, people, and resources that help others to improve their physical, emotional, and financial well-being. I'm your host, Dave MacNiven, and today I'm excited to welcome our guest, Dr. Annie DePasquale, to the show. Dr. Annie is the founder and CEO of Collaborating Docs and is a board-certified family medicine physician. She also happens to be the first doctor we've had on the show. So, Dr. Annie, welcome to the show.
Thanks so much for having me. I'm excited to be here.
Yeah, we're excited to have you and to talk a lot about, what you do with Collaborating Docs. I did a little bit of research on your website and just took a look, and it seems like there's a whole world there that I'm not quite aware of. And so I'm really excited to learn more about what you do and how you got started. But we usually open the show with just a simple question. And that question is, what makes you happiest these days?
I have 4 young children. I have a 2-year-old, 5-year-old, 6-year-old, and an 8-year-old. So honestly, it's quality time with them. And I do want to use that qualifier, not just any
Yeah,
old time with them, which can be chaotic and stressful, but when you have, the good moment, the walk to the park, the nice little conversation in the car, all those little nice parts tucking in at night, that's
absolutely.
what I'm
Yeah,
savoring.
that's awesome. Did you really just tell me you have a 2, 4, 6, and 8?
Yes, it's a little bananas at our household, but
That's amazing. That's so exciting. I have 2 of my own, but they're teenagers now, so it's completely different. I miss those days when they were that young. It goes by quick.
we're trying to savor the moments. Yes.
So you are the president and founder, or CEO and founder of Collaborating Docs. Tell me a little bit about what you provide and what you do.
Yes, so we help with a very interesting niche that is not well known unless you're part of it. So we help nurse practitioners and physician assistants who are trying to have their own practice. And in the about half of the country in the US, if you're a nurse practitioner, you need to have a collaborating doctor, which is a doctor you can turn to with clinical questions, review charts with them, go over really just any concerns you may have about your patients. They're not with you day by day by your side in the clinic, but rather you can call them or text them for help. And physician assistants actually needed in all 50 states. So we are nationwide, and in a
Wow.
way you could consider it sort of like mentoring, just having someone with a little more experience in your back pocket to call or reach out to if you have some questions while you're taking care of your own patients. So I think it's a great system that, is kind of mandated by law in a lot of
Yeah.
places, but I have started the company to really elevate, the type of care, because it can be, unfortunately, in some cases in the real world, a bit of a joke. Like, I have this doctor, but I can never get a hold of them and I
Oh,
don't know who
that's
they are.
interesting.
And
Yeah.
so we make sure our doctors are very involved and supportive and helpful.
That's amazing. Where are you based out of?
We're in Arlington, Virginia, right outside Washington, D.C.
Oh, wow. Okay. And you said it's about half of the country where this is required. So does that include here in the Northeast where we are?
It really is so variable. It's very state by state. So in the Northeast, we do help in New York for it also varies by length of experience of the provider. So in New York,
Okay.
it's needed for about 1 year of experience, like right out of nurse practitioner school. And then they kind of graduate to be fully independent. So yeah, it's extremely variable. It is more common in the south of the
Okay.
US.
Gotcha.
Yes.
So, nurse practitioners and physician's assistants, that's what you're supporting with the collaborating doc. What type of businesses are they in where they need that collaboration?
It's fascinating. They do such a variety of things. The biggest two are definitely primary care and mental health care. Mental health is really booming right now, especially for such great demand and need for that. And nurse practitioners can get a special certification. It's called their PMHNP, Psychiatric Mental Health Nurse Practitioner program. So then they have that specialized training to help. So, but I would also add in, on top of the big two most common things, we get a growing need and interest in aesthetics, IV hydration, hormone replacement, men's and women's health. So
Yeah.
I actually like the people that have kind of a niche practice. I think it's easier to market and
Sure.
get a
Yeah.
good client base.
Probably keeps things interesting too.
Yeah.
That's great.
Exactly.
So, with the primary care practice, is this a primary care practice that doesn't have a doctor involved? Because I didn't even know those existed.
Right. A lot of people have no idea because they don't come across it, but a lot of nurse practitioners do set up their own shingle out in the real world and see patients on their own, which is great.
That's amazing. Well, there's definitely more I want to talk to you about that. But first, let me ask you how you got onto this path in the first place. What's your background and what brought you to this business?
I was practicing family medicine full scope in Washington, D.C. for many years. I was at a federally qualified health center that helps patients that are sort of underinsured or uninsured. I loved working there. Did not have the highest salary in the world working in a more low income area. So I was looking for other side jobs and I fell into collaborating. I found some nurse practitioners and physician assistants who needed help with this. And it was really fun for me to help them with their practice on the side of my practice. Just, they could call me when they needed something and I could step away and help them for a few minutes or call them when I was, off of work to go through what their concerns were. Before medical school, I was a teacher, an elementary school teacher. So I do love teaching and that sort of dynamic. So it was a good fit. But to make the story short, lots of people were coming to me asking if I could be their collaborator. But safely, I can only help so many people at a time.
Sure, I'm sure. Yeah.
So I thought, well, this is interesting. Maybe I can play matchmaker and connect all the people coming to me with doctors that I know and trust. And it started very small like that. But then there was such high demand that I started to expand across the whole country and help, a whole lot of people.
That's amazing. Are you from Virginia originally?
Yes, I'm born and raised in Virginia and raising my family here. So
that's excellent.
Yes.
So, and have you maintained your own practice while you're doing this work as well?
I did have to step away, or I chose to step away about 2 years ago from practicing medicine. I know you all are a lot about, wellness and having a good balance in life. So I was working full time, seeing patients, but then also running a business that was very busy, which was also very much full time. So I did need to cut that down, but I feel much happier and less stressed focusing on one thing.
That's great.
It was the right decision.
I love that you kind of saw a need out there and then designed a business in order to meet that need. We talked to a lot of entrepreneurs that kind of have that same element in their story. And I find that really fascinating that, it kind of changes the trajectory of your career. And really your life, because now it changes how you're able to raise your family and the time that you have as well. How have you found that transition for you? Has it helped you to kind of maintain a balance between work life and family life?
It's always a challenge in the sense that I work 80-hour weeks
Yeah,
week
right.
after
I'm
week
sure.
with no vacations. However, despite the long hours, I do think being an entrepreneur, you are definitely way more in control of your schedule. So when there's the dance recital in the middle
Yeah.
of the afternoon, I can get there and be there, which when I was practicing medicine, I wouldn't have probably been able to do that. So I do enjoy that part. But burning the candle at both ends, that's also a little hard, but
Yeah, I get that. I can understand. I was in the nonprofit world for a while, and that work was nights and weekends, and it was a lot. And I switched careers because I wanted that flexibility. I didn't want to miss out on the baseball games and, on those things with the kids. So I work a ton, but I do have the flexibility of being there when I want to be there.
it seems like the better situation,
Yeah.
definitely.
Yeah. I think for me, it's definitely been helpful. It sounds like it's the same for you.
Yeah.
So with collaborating docs, how do people find you? Like, when do they actually recognize that need? And then what's the process like?
Usually people have in the back of their mind, they want to branch out and do something on their own. Or perhaps they're a little further down and really have set most things up. And the last missing piece of the puzzle is getting that doctor on board. It is often the roadblock for a lot of nurse practitioners and physician assistants that, how am I going to find this doctor? I know doctors, but they don't, they're not interested in helping me. They don't really understand what I need.
Sure.
I don't want to ask a friend that feels obligated to do this. So it's nice to have, this as an option, like a professional service that can step in and help, that you don't have to ask for favors and,
Right.
whatnot. So usually people come to us directly through our website, which is collaboratingdocs.com. And on there, you can book a call, which I'm proud to say you would speak with a nurse practitioner. We've hired a full team. Currently, we have 5 full-time nurse practitioners who take those calls and get
amazing.
to know the client and what you need. And they get it, right? You're talking to a colleague, and it's a lot easier conversation to explain what you're looking for.
You're speaking the same language.
Yeah.
Yeah.
Exactly.
That's great. Now, you really haven't been in business all that long, right? So you've scaled this up pretty quickly.
Right. We started in 2020. So in just hasn't even quite been 4 years. We've helped over 4,000 nurse practitioners and PAs. So
wow, that's really amazing, especially considering the pandemic we went through.
Right. If anything, I think it fueled it. It wasn't intentional. I wasn't, doing it based on COVID, but I do think a lot of people wanted to branch out on their own during that time to get out of the hospital, to get out of maybe unsafe working conditions and do their own practice.
Yeah, it probably inspired a lot of people to kind of take their careers in a different direction.
Yeah.
Yeah. And that's kind of, it's nice that you saw that and you saw that need and were able to kind of create a business around it. So you have 5 staff members. Do you have any other support staff or anybody else that's involved?
We do. We have 2 other. So the 5 nurse practitioners are on sort of our onboarding team, is what we call them, the team to get, help new clients coming in. We have 2 other nurse practitioners who run our client success team. So once you're a client, if you have any issues or you need help with figuring out credentialing or whatever you may need help with, they can jump in to help. And then we have a couple operations people, and of course, finance and tech and all that. So we have about a dozen or so employees currently and about a dozen contractors who help with various tasks. So yeah, it's been exciting to see the growth because I did everything myself for about the first year and a half. So
yeah, that's amazing.
Pretty exciting.
Very cool. Now, was it challenging to kind of take it into all 50 states? Are there any sort of things that you have to navigate in order to be able to do this work in all the other states?
It is complex because every state is very different and has their own regulations. So we, our lawyer, I joke, I'm putting his kids through college because we need a lot of legal advice to keep things compliant, which is very important to us. So yes, Ted, every time we brought on someone in a new state to us, we'd have to dig deep into the regulations and get that together. And now we have to keep it updated. We have it for all states, but we have to keep it fresh. And things change a lot. So again, my lawyer is not hurting for the college tuition money, I don't think.
Yeah, you keep them busy.
Yes.
That's great. And how do you see it going? Like, do you have kind of a goal for where you want to take the business?
Our goal is to be a household name for nurse practitioners and PAs, more so if they ever have had that dream to start a practice. This little piece of the puzzle is not what will hold them back. I can't do your marketing for you and set up your website, but if finding the doc is the thing that's the holdup, we want people to know that should not be an obstacle.
Well, I can also imagine you've probably now developed this network of people, right? That, you can probably connect people to see, how do you do this? What's your experience been like?
Yes, exactly. We're hoping to actually kind of push that out a little bit more formally with maybe like a bit of a mentorship program soon, because we have some very successful clients that have so much knowledge that they could share with kind of up and newcomers trying to figure this out. So I'm hoping to find a way to connect everybody.
That's awesome. And you kind of touched on the fact that you started with, mental health and primary care, but then there's all these little niches. What are some of the ones that you're noticing that are kind of becoming trendy or developing a little bit more than usual?
Yes, we do. Up and coming, I would definitely say aesthetics, in the sense that it's pretty easy to take some courses. There's no nurse practitioner or physician assistant certification in aesthetics, but you can take weekend courses where they have actual people that you get to learn how to do Botox and fillers and really start to be comfortable doing it, and then branch out and do that. It's very lucrative. It's a low barrier to entry because you don't necessarily need to have office space. A lot of these clients are happy if you come to their place of, their work or home, or, have like a mobile type situation.
Yeah.
Bachelorette parties, and, they're all kind of
wow. That's so interesting
ways to do this.
Taking the medical profession into all these different areas. That's interesting.
Yeah. And we also do see a lot with the growing HRT, hormone replacement therapy. As a physician myself, it's not I would say, just, generally speaking, a lot of physicians don't get too into like inserting pellets for hormone replacement and other sort of hormone options that are out there. I don't know why. I'm sure endocrinologists do, but like general practitioners like me, I have no training in that. I don't know really much about that, but I'm seeing a lot of the nurse practitioners and PAs getting that training and then building an entire business around that. So I think that's kind of a good option. They become the specialist in that area. Yeah,
for sure. Yeah, lots of opportunity there, I'm sure. And what are some of the big challenges that you are facing now, or maybe that you foresee in the industry?
Well, the biggest challenges of our clients in general is it's difficult to start a practice that is very successful and profitable. It's hard to get clients in the door and keep coming in the door. And, that's on more the micro level. Just, we're always trying to pour into our clients good business advice and marketing advice, branding, things to keep them afloat and make it, work for them and their life and their career. The industry as a whole, I think, is in an exciting time that there's rapid change in state regulations and really, I'd say primarily loosening of regulations. So it's opening it up more For example, actually, we didn't really talk about them because we don't yet help them, but pharmacists I think it's over 30 states now can prescribe medication, can treat patients and prescribe like a certain types of medications through their pharmacy. That's brand new. I mean, that even 5 years ago, was not happening. So this is I think it's a great thing that the country is looking at ways to expand access to care when there's a shortage of primary care doctors and providers. So it makes sense that maybe a pharmacist could help with certain types of ailments and do it efficiently. And so we plan to expand our service to help pharmacists as well who need a collaborator, which I think they all do. So yeah, there's a lot of exciting things on the horizon.
That's really interesting. I've always seen people, I work in Medicare, I help people with their Medicare choices, and I have a lot of clients who trust their pharmacist more than they trust their doctor. It's like that's the person that they go to. So that's amazing that that's actually starting to happen a little bit more.
I agree. Yeah, pharmacists, they're great at teaching. They always encourage you. Do you have questions? You want to talk to the pharmacist?
Yeah, of course.
So it makes sense that they can have a bigger role. I'm glad it's happening that way.
Yeah,
Yes.
that's really great. And they also, the best ones also help their clients and their customers to navigate through their insurance coverage as well, and to help them maybe with, finding a discount program or talking to them about alternatives, which just, I think, helps with the whole holistically looking at that patient, making sure things are going well for them. So the pharmacist is a real crucial part of that picture.
I couldn't agree more. Right. I'm guilty as charged as a family doc. Like, here's some, I sent it to the pharmacy and then it costs $3 million. So is there another option? We're not as aware of the cost or what coverage.
Yeah, of course.
Works.
Yeah, we do that as the insurance agent. Like, we do a lot of that too, because that's the most confusing area of Medicare, I know, is the prescription costs and how they change throughout the year. So I always tell my clients, if you have a question, you run up against something, call me, because I can assist you with that too. And I can communicate with your doctor or pharmacist and help you to figure out a way through.
That's great. Yeah. That's a big help.
Yeah.
Thank you.
Yeah. It's just such a complex area that people are dealing with. So the more support, the better, for sure.
Yeah. Navigating healthcare is no joke. I mean, you have to be your own advocate, and that's very hard. And some people really can't be an advocate for themselves. So it's a tricky,
Yeah.
Our system is definitely broken.
Yeah.
But
it's tough, but there's a lot of people, I think, that are doing the right thing and helping people as much as possible. So that's kind of what we're trying to do with the podcast, is to highlight those folks and to make sure that people know there are resources out there for help. And this sounds like something, like I told you, I didn't really hear about any type of a service like you guys are providing. I didn't even know that was a thing. So it's really amazing to learn about that. And for people who are getting into the healthcare field and becoming doctors and nurses, to know that there's a lot of opportunity out there and there's a lot of different ways that you can take your career.
yeah, if you enjoy mentoring or teaching, if you're a physician, we'd love to have you with that aspect. But also, I think it is nice for the newer graduates of NP and PA school. Like, you don't just have to go work at someone else's practice or in the hospital. The world is your oyster. You can start up your own practice and do things your way, be the boss. So
yeah, for sure.
I think that's appealing to a lot of younger folks, especially.
Are you doing anything to get the word out about what you guys offer? Do you go and speak to groups or get out there at all?
Yes. Last week we were at the big AANP. It's the American Academy of Nurse Practitioner. They have an annual conference. It was in Nashville. So we had a booth and we talked to hundreds, if not thousands of people there. So it's fun to get out and meet with people. But we do paid advertising and email marketing and things to also get, the word out.
Awesome. That's great. And how do people find you? Is it typically through the website?
Typically, yes, that's probably the best way. We do have a bit of a presence on social media. If, people are into that, we have a YouTube channel and we push out a new video every week. We're also on, the normal Facebook, Instagram, Twitter, LinkedIn. So you can find us there too. But Yes, I'd say the website's kind of our central hub.
Right. Okay. And people can reach out through the website and get a consultation so that, okay, gotcha. So they can see if it's a good fit for them.
Right. It's no obligation. Just talk through what you're thinking of doing, and we can let you know if, how we could help.
Yeah.
We do have a lot of resources, like even financial resources and just good ideas for people starting out. So we try to pay it forward and really help equip people with what they need so they can succeed. So even if you don't use our service, happy to talk through different ideas and put you on the right path.
That's awesome. That's great. Now, for the last part of this, because I know you've got a busy schedule ahead of you too, but it sounds like you have so much going on. I mean, 4 kids in this incredible business. What do you do in your own practice to maintain your health or to kind of enhance your health?
I do try my best. There are, as we all are human.
Yeah.
A few tips I have. I knew this may be a big topic of this conversation, so I thought of a few things ahead of time. One, I highly recommend working where you can walk or bike to work. So I can walk to work. It's about a mile, but a mile is perfect. It doesn't take all day. I'm not super sweaty when I get there. All is well. And then you have that. I love my walk home because I can kind of settle and get in a better frame of mind before I walk in the door to my 4 rambunctious children. So walking, I'm a big, I used to be a health coach, actually a weight loss coach before I did this business on the side. So I am a big water fan. So getting like
Very
the
nice.
tumbler for water and
Yeah.
just make it a habit where you have to get through that by lunch and then do it again in the afternoon. I think having to not really think so hard about it is always helpful.
Yeah, that's a great tip.
And I'd say sleep. I do not sacrifice my sleep. Of course, having like a newborn, which we've had 4 times in the last 8 years, that kind of throws that out the window for a while. But minus having a newborn, I turn off my computer, my phone. I know I have to get 8 hours. I'm one of those people. I cannot get by with 6 or 7. I wish I were.
Yeah.
but even those folks, I think, we're learning more about the negative side effects of not getting enough sleep. Even if we feel like we don't, I think everyone does need a good amount of sleep. So I'm too old. I don't sacrifice my sleep no matter what. So
that's amazing. I think that's really important. I think a lot of us don't prioritize that enough. And many of us have operated on, 6 hours of sleep, 4 hours of sleep a night when that's really not good for you.
It's coming out. Yeah. All these studies about that. And my poor husband, he's a awful sleeper, lifetime, terrible sleeper. But yeah, he gets like 5 hours and I'm just like, this is scary.
Yeah.
We need to figure out how to get you to sleep more. Yes. So.
All right. So those are 3 great tips. Walking. I think, proximity to work is such an important thing sometimes. I know not many of us can do it. But if you can, I love being able to take the bike or walk to work. But the hydration, I carry a large water bottle with me everywhere I go as well. And the sleep. So those are great. Very cool. Well, I know that you have a busy day to get to. I know we had some technical challenges in the advance of this, but I really want to just thank you for taking the time to talk to us about your business and your life. And this has just been a really amazing conversation for us. So we appreciate you taking the time.
Thanks for having me, David. Yeah, it was really fun to talk. And I think it's great what y'all are doing, just really pushing out or encouraging people to follow their dreams, and especially if it leads to like a healthier outcome and to be in a better place personally and professionally, but also health wise. So kudos to you guys. And I'm proud to be the first doc on your on your show. That's exciting.
Thank you so much. And we'll be sure to share your socials out and your information for people who need those services. Let people know about those. And, we would love to have you back on at some point too.
I'd love to do it. Absolutely. Thank you.
Awesome. Well, thank you so much, Dr. Annie. We are so excited that you were here to join us today. And thank you all for listening to Sounds of Health. Make sure that you continue to share, like, subscribe, get the word out about this podcast. And thank you all for being here. Sounds of Health is brought to you by Nutmeg Insurance Advisors and recorded at the offices of Nutmeg Advisory Group. The podcast is produced by Jason Carubia and Dave MacNiven with music by Rob Hames. You can find us on Facebook, Instagram, YouTube, X, and wherever you listen to your podcasts. Your support means a lot to us, and we appreciate it when you like, subscribe, and leave a review. If you know someone who you think should be a guest on the show, please email us at soundsofhealthpodcast@gmail.com. Each week, we help you move the needle toward better health by spotlighting the stories, people, and resources that inspire and motivate others. And we are just getting started. Help us share these sounds, and don't keep us a secret.